Hello. What's up? Trying to get comment posted. It's not necessarily working like it usually is. Oh, I'm loving the Instagram updates. Nothing works the same. Okay, so let's try this. Okay, well, I was trying to pin a comment at the bottom of the post, but it's not working. So, this type of stuff happens. And so we're just going to roll with it. All right, so what I was going to pin at the bottom was actually letting you all know that Whitman-Walker is still open for HIV STI testing. You can actually call us at 202-797-4439 for that. It's by appointment only, so please remember that. And if you are unable to get someone by phone, you can email us at appointments@whitman-walker.org. You can also email there for COVID-19 testing appointments. So if you're looking for a COVID-19 testing appointment, that is the email address you'll want to utilize. So I am excited about today's topic. We're going to discuss a little bit about the holidays, some impacts and things that may have on some of us, and we have two guests here that are going to bring some interesting narrative to the conversation today. So I am David Wilson. My Instagram name is sir_Dave_. So if you're interested in following me there, you can. I want to just say, the holidays, is an incredibly joyous time of the year, of course. We have all of our celebrations, our tradition, and the time that we spend with family. But beneath all of that joy that's on the surface, this time of the year can also bring on a lot of stress and a lot of triggers. Maybe it's because, you have difficulty with family. Maybe it's because of memories of negative holiday experiences that you've had, or just maybe because it's something else entirely. This year's holiday season might especially be difficult because of the pandemic we're experiencing. COVID-19, has made many people sick. So many loved ones are sick, of our loved ones are sick. So many can't see their loved ones because of this. And pretty much everyone is just fed up with the constant uncertainty. So I'm bringing two people on, two special guests. The first person I'm bringing on is Shayna Thomas, who's a licensed social worker who serves as a psychotherapist at Whitman-Walker Health. And I want to please note that I want you to comment. Hi, looks like we have them here. And so we'll get them to join. See if that works. All right, so how are you? Oh no, Chat, you ruined the surprise. You were the next guest. I gotta get the first
Oh,
guest
you got to
now.
put me away. All right, where's
Yeah, no,
Shania?
you're after, but we'll come back to you in a second.
Okay, I can't wait to hear what Shania has to say.
Yeah, same.
Hmm.
We're having some technical difficulties today. It's hilarious too. I'm having the best time over here. All right, so let's see what we got. There we go. This is always fun, right? How's it going?
Oh, professional. Hi.
I was
I'll go
like,
first.
yeah, this was so perfect, right? So, would you like to introduce yourself to our viewers?
Sure, I can. Hi, everybody out there in Instagram land. I'm Shania Thomas. My pronouns are he, she, and doctor at this point. I am one of the youth psychotherapists at Whitman-Walker Health. I've been there for 5 years.
Nice.
Yeah, and I'm excited to be here and talk about the holidays.
Yeah. So, do you have any opening words that you want to leave with the viewers, or I know I put you on the spot, like.
Right. Yeah, I mean, what we're going to talk about in terms of just like family, and the pandemic, like I think one thing that I had to really like dig deep into myself is that I had family all the time during the holidays. Like we always visited each other. We were always interacting with each other. We exchanged gifts. We had a whole thing, Christmas. And just thinking about how like it's almost a little jarring to not have that this year. So I'm interested in kind of having that conversation. And I think, yeah, and coming up with some creative ways that we can all like get some care, this holiday. So yeah, that's all.
Absolutely. So I do want to remind everybody who's tuning in to feel free to drop in the comments. If you have any questions, we'll be sure to address them in real time today. Especially since we have a doctor here, we get your answers for you. All right, so we'll start off with the Q&A. Shania, if you want, I'll just hit off with the questions and you can give the response, and we'll just go like that. Let it flow.
Sure.
All right,
Okay.
so what does the holiday season, mean for you, and what have you heard it mean to some of your clients?
Gotcha. Yeah. Like I said, I am from Hampton, Virginia. So, and my family's from like North Carolina and Georgia. So we are very much into the holiday season. We did all the things, we traveled to see my grandma, we always had a Christmas party every year. We always went around, to the neighborhoods looking at Christmas lights. So like it was really instilled. And I think as a person that now also has a little one, like those are things that I'm also kind of instilling as holiday traditions. So the holiday season for me is pretty big because that's intentional time, especially if I haven't seen any of my extended family. That's when we saw each other. What I've heard from it mean to my clients, as a therapist, I had to learn that my experience is very different from everybody else's, right? Like some people are not as close to their family. Some people are not interested in participating in holiday things. You have some people that it's time that they kind of avoid, and they're just like, if especially if you don't have family that you're connected to, especially by blood, then people are like, I don't even want to have a conversation, or I try to avoid talking about that. So it means various things for different people. And I think the common thread that I'm seeing is that everybody at this point is struggling, with the fact that they're isolated and alone, and that we've been doing this for what, 15,000 months being in the house so far. So I think I've been saying this in my sessions, is that I think that people are at the point where we thought that this was going to be over, right? Like we didn't have our summer, we didn't have our joke with my clients and said we didn't have our hot girl summer. We didn't have like a really good fall. Like now it's getting cold. It's dark at 4:30. We got to stay away from our friends. People are getting sicker. We're having family members. That sickness is coming closer and closer to our circles. So I think that everybody is just really having a hard time understanding that this will probably be our reality for the next couple months. And that doesn't feel good.
No, it actually doesn't feel good. And I don't even consider myself like a big holiday person, per se. But I felt like if any year I needed the holidays in the family, it was
Mm-hmm.
this year. I
Yeah.
was like,
Yeah.
damn, like I really
Yeah.
would have liked to spend time with my family because, I mean, it's like you don't know what you you don't know what you're missing until it's gone, right? And so it's like, dang, I usually take that for granted, and now I'm like, oh, I really wish I had the opportunity to spend time with family. But I'm following the guidelines that the CDC says.
Right. Because we want to make sure that everybody stays well, right? And that's the only way that we're going to be able to do that, and to have a Christmas next year is just to make sure that we all do the thing we need to do to like be well this holiday. So yeah,
Yeah.
absolutely.
So kind of on the lines of that, like, how do you anticipate COVID-19, the pandemic, affecting how people celebrate and experience the upcoming holidays?
I think people are just gonna hunker down and stay in. I did see as much as we would like to go with the CDC guidelines and hope that everybody's like wearing a mask and stay in the house, right? Like people weren't. And I think that people were being a little bit more creative in how they interacted with folks, especially their family if they were going to go see them. I think some of it is people had gotten tested. People had made sure there were masks. They had no more than 10 people in their house. And from what I know, there are some people that I actually know that had still gotten sick, even after kind of being as careful as they can. So I think it's going to affect the way that people are able to join together. I think especially now this time, especially with all that's gone on this year, like people are missing that intimate, and or platonic or even just familiar touch. Like, I've
Yeah.
heard a lot of clients especially around kind of this season of just like when seasonal affective disorder kicks in, where it's just like nobody has touched me since March. Nobody's hugged me.
Yeah.
Nobody has rubbed my arm. Nobody has done any of that. So I think people are trying to be as creative. Like it's almost like toeing the line, right? Where it's just like,
Yep.
I'm going to get as close to the line as possible. But even then it's a little bit risky, right? So I think people are just having a hard time figuring out like, how can I still get my need met and still be within the guidelines of the CDC?
Yeah, and that is a challenge, definitely. I mean, I'm definitely experienced a lot of what your clients are describing as well. So what do you recommend someone does if they really want to see their family, but they can't? How can they stay in touch and get some connection?
Being apart is really rough right now. And I've been really exploring with folks who are just like, I can't, like, I gotta see my grandma, I gotta see X, Y, and Z, I gotta do whatever. We've been being creative. And so I have some clients who will like, I really loved in the beginning when all this was happening, when people were doing like the drive-by birthdays. So
Yeah, and the
some people are doing like
graduations
the
and
drive-by, waving out their window at folks. I had one client talk about their experiences of cooking food and dropping it off
yeah.
at people's houses, like leaving it at their doorstep, and then people doing an exchange in that
I actually
sense.
had a friend do that for me on Thanksgiving. Cook
Kind
food
of
and
like how
drop it off, and it
nice.
was a surprise too. So I was like, "Oh, this wouldn't even happen, if we were in traditional times." And I was like, I really appreciated that surprise of it. Yeah,
Yeah, it's nice to, people want to find ways to exchange energy and be safe. So, I've been also talking about like, I know that we're all zoomed out and that we're internet out and all that, but Zoom, Google Hangouts are helpful.
this.
I've been also this Instagram lives. I've been like pushing like a Netflix gatherings too. I'm just like, okay, so everybody at this point has some sort of or a password access to one of the many different the many different platforms. I was just like, so do like a Netflix night. So watching like, holiday movies or whatever your thing
Yeah,
is and getting together and being able to do it that way. Also just good old like phone calls, writing letters to folks, you can still send gifts, you can still find ways to be as creative as possible. And I know it's hard. I know it's not the same as being in presence of a person, but in times of struggle, like this is where we get most creative to make sure we get our needs met. And to get that community care, it might need to be different than sitting in front of a turkey and eating. It might just be like waving at somebody from the porch or,
yeah,
making sure you drop off a gift. So, be creative and know that even though it might not fulfill the satisfaction that you want, that it's something, right? It's a little build toward hopefully one day where you are able to sit in front of that person. So,
yeah.
we're hanging on to hope, but we're doing a good job because we're here.
Exactly. Well, those are actually all the questions I have for you today. Did you have anything else you want to leave? I didn't really see any questions come into. I just seen someone talking about stress eating, and I'm like, oh yeah. So I ain't got no advice on that because
I
I'm
was just
stress
like, it
eating
really
too.
depends on where you are in the quarantine list of on the quarantine bingo. Like, I have obviously bleached my hair, I have painted my walls,
I
I have
dyed
not
my
baked
hair
bread.
too.
I have not baked bread yet, so I am still on the baking bread tip.
I made
Um,
bread. I colored my
okay.
hair. I did like a burgundy color. It was actually nice. And then I did what else? Oh, I've gotten really good at cutting my own hair. Something I probably wouldn't have.
That's my next venture.
Yeah, because
Okay.
I used to be like, oh, like I'm not gonna, I'm in the house more, so I'm like, if I mess up, I could just like stay in the house for
Or wear a hat, right? Just like
right.
nobody has to see it. So yeah, be creative. This is a time to like get into new things that people just haven't done yet. And also it's sad, right? It's sad to be apart. It's sad to be isolated. Give yourself space to be sad. Give yourself space to mourn. We are all grieving right now. So please do not, railroad over that feeling. Like sit in it and then call somebody. Look at really great Instagrams, or get on Twitter, or find other ways in order to kind of take that energy. But don't I know it's hard, but don't lose that feeling. Definitely recognize it, honor it, give compassion to yourself, and bake some bread.
Absolutely. So thank you for joining us today. We really appreciate it. Yeah, so thank you. All right.
Thanks.
So now we'll
Um,
get Chad going next.
all right, bye,
All
everybody.
right. See you later.
Bye.
All right. Now it's time to welcome Chad Wheeler, another social worker who serves as a behavioral health therapist at Whitman-Walker. So we're going to get Chad in there now. Let's go. All right.
Hi.
Now I got you where you're supposed to be.
I'm back. It was lovely hearing Shayna. I got to kind of sit in with all of that.
Yeah, it was great. So would you like to introduce yourself to our viewers?
Sure. I'm Chad Wheeler. I'm one of the behavioral health specialists at Whitman-Walker, which means that we do a whole host of things. So I see individual clients. I run a couple of groups. We also are kind of the entryway into behavioral health services and do letters of support for individuals looking for gender affirming surgery. So we get to do a lot of great stuff.
Amazing. Do you have any opening words for our viewers at all?
Opening words. Sure. I guess my main thing that I've been touting to clients and groups is self-talk, as far as kind of making sure that the most important conversations that you have are the conversations you have with yourself inside your head. And that during this time and COVID and all of that, oftentimes we talk to ourselves worse than we would talk to anyone else. We say the nastiest things to ourselves, and to kind of being able to call yourself on that and be gentle and loving to first and foremost to yourself during the holidays.
That's good advice. It's actually different advice that I would expect from a behavioral health specialist.
Oh,
to
really?
Talk to yourself. I'm like,
yeah, you don't need me.
A negative thing,
talk
but
to yourself.
But no, I love it. Say positive, affirming things to yourself. That's good. I love it. All right, so I have a few questions for you. We'll go through the Q&A like we did with Shayna, and you can kind of just fill in for me there. So first question is, if I am doing something this holiday season, how can someone prepare for potential challenges or triggers or stressors that I might encounter during this time?
Well, whether it be in person, if we're doing the in-person thing, as far as, if we've got our masks on, but we're still seeing people, is that, triggers are a big thing, whether that be in relation to something, if someone's in recovery from something to do with alcohol, or maybe something with food. I saw a little bit of comfort eating stuff, which can be anywhere from COVID comfort eating all the way to eating disorders. And I do an eating disorder group for male gay men currently, and there is another eating disorder group at Whitman-Walker for anyone in the LGBT community. And we make sure that we're just kind of aware of what kinds of things are our triggers. Like, some of us going to be with family isn't necessarily the merry and bright thing that we think or we'd like to picture. And that sometimes we get triggered by other family members' political views, religious backgrounds, things that are in contradictions with the way that we might be living. And being able to be with those individuals and maybe not engaging in those kinds of conversations and things that may feel like, I gotta have a drink to be in this situation. I'm gonna either have to be drunk or I can't go at all. Those kinds of things that we might be recognizing in ourselves, or that, you know, I'm going to have to eat the entire dessert bar that's available for me to be able to feel good about this. So
Yeah.
just kind of knowing those things ahead of time, and kind of making a plan for knowing that sometimes we feel like the 13-year-old kid that we once grew up with as soon as we get back to family, and finding a ways of letting people that might be kind of looking for controversy and not engaging, and just choosing to let people say what they will, and, you know, choosing not to engage.
Yeah, so I actually, and this is outside of the questions, it's a question from me to you. Um, how do you typically, recognize, that you're experiencing a trigger? Because I think sometimes I don't know until I've already reacted. You know what I mean? And so
Mhm.
it's like, I'm sure there's some type of buildup that I'm just not acknowledging. But like, how do you know, or do you have any advice for those people like me who don't necessarily or can identify in that moment when they're experiencing a trigger?
Well, the main key thing is in what's called mindfulness. It's just having an awareness, and mindfulness is a really big key component of a lot of therapy right now. It's just having an awareness of self and maybe taking a pause. Whatever the case may be, we get something that's brought to us and it will immediately stir feelings of rage, sadness, whatever, and just taking a moment to sit back. So if you're kind of presented with something that you feel might be a trigger, of taking a moment to kind of pause, really kind of see what's going on with you physically. Are you getting hot? You know, are those kinds of things starting to occur with you? Taking a notice of what it's bringing up inside of you, and a little bit of that internal conversation of being able to be like, what's going on here? What's really
Yeah,
kind of what's stemming from things before we react, before we respond, before we take that drink, before we have a piece of pie, taking a moment to be with yourself and see what's going on there.
exactly. Thanks. Thanks for
Mm-hmm.
that advice. Great advice too. So if I am met with a trigger or a challenge, how can I manage it? You kind of mentioned about taking a pause, but is there anything else that a person could do?
Well, I mean, there are kinds of things as far as boundary setting is a really big kind of thing of kind of knowing who in your family or people that might need a boundary, of kind of saying, you know, if you do have to engage, of being like, you know, during this, I've decided that for this time that I'm not really going to engage in political conversations. The end.
Yeah,
That's the end of that situation. So, um, doing those kinds of things, and, you know, also on the other end of things, of thinking about, sometimes we may not have the opportunity to be with family and all those kinds of things, so loneliness is going to be a big deal, and kind of being okay and being alone, and those are kinds of things that happen a lot. Holidays is not necessarily a happy time for everybody, and that's okay. The expectation is we're all supposed to be caroling and, you know, frolicking in
yeah,
the snow and whatever the case may be. And sometimes if we've had a recent loss or things aren't going very well, it can be a very kind of sad and dark time.
yeah.
So reaching out when you can, and knowing that it's okay to have a sadness around this time. I don't know if that
Absolutely.
kind of went off from your question, but
No, I
thought it
think
was
that was great. I think it
okay.
makes perfect sense, especially for like a person I mentioned earlier with Shanae on that I'm not typically, a holiday joyous
Hmm.
person. I'm just like, it's just December.
Good.
Um,
Hmm.
and so like I think that advice was good. It was very fitting for a person like me. So thank you.
Hmm.
So what services can I access if I do need help?
Well, I mean, as far as Whitman-Walker goes, you know, we do have kind of groups that are ongoing, and some of those kinds of things, as far as having a virtual group, even if you aren't experiencing, you know, virtual family, or you're feeling alone, might be beneficial. Like I said, there's an eating disorder group, either for gay men, which has a really strong kind of situation with body image and eating disorders. So that group is going strong. some other just situations, because, you know, if you do have disordered eating or body image issues, holidays can be a real tricky time. So we have that. We have a whole substance abuse program if any of those kinds of things are of a concern to you. And any of the behavioral health specialists can help you get connected with that. Stress management, we have a full peer support system with other people that have been trained to be of support during this time or any time, really. But then there's also 24 hours. I think I saw someone post about it. Any kind of anonymous meetings have 24-hour-a-day Zoom meetings to being able to go through the New Year's and holidays. All the hotlines or suicide hotlines are all up and active during those kinds of times. If you are able to do anything like volunteer, I'm not sure what's available now with the whole COVID world, but a lot of people find it really kind of holiday warming and being able to get that kind of feeling to help others during this time, and food kitchens and those kinds of things. I'm not sure how they're running this year, but it's definitely something to investigate if it sounds interesting to you, and just kind of reaching out to those you care about and knowing that it's okay to say, I'm not okay.
Yeah, exactly.
Mm-hmm.
Well, thank you for sharing those resources.
Yeah.
Do you have any additional closing comments? Those are all the questions I have for you for today.
No, I guess that's really the main thing, is to just know that when in the holiday season, if you have had a loss or things, you've broken up with somebody or anything, that's, you know, that is really kind of, we found that that's a really, for whatever reason, maybe people don't want to give the gift or something that they break up or something, but it is kind of a harder time for a lot of people, that you're not alone, that there are places that you can reach out, and there's a lot of other people that are not necessarily frolicking in the snow. So know that you're not alone, and that there are things to be able to do, and reach out if you need to.
Absolutely. So thank you for joining us today, Chad.
Yeah,
I appreciate it. And love your perspective. So thanks again. And yeah, until next time.
Happy this season, everyone.
Yes. All right, so let's thank Shayna and Chad for joining and giving us a little advice how to get through this holiday season, especially during the pandemic. I really appreciated that insight. I hope you all did too. I do want to remind you all that Whitman-Walker is still open for free HIV and STI testing by appointment. That is at our Liz location in Northwest DC, as well as our Max Robinson Center location, which is in Southeast DC. If you can make an appointment by calling 202-797-4439. I also want to remind you all that we are, in the middle of this holiday season, but social distancing is still the best way to reduce the amount of COVID-19 community transmission. So what does that mean again? I'm going to continue to remind you this. It means you're deliberately increasing your physical space between people to avoid the spread of the illness. So, especially around the holidays where people are used to traveling, make sure you stay at least 6 feet away from other people when possible. Wear a mask in public. Avoid places with large crowds, that's including people homes or anywhere else. Just avoid it if you can. Encourage work from home if you are working from home during the holidays. Also, speak with your loved ones via Zoom, FaceTime, and I've actually gotten closer with my mom during this time via FaceTime, because I think she knows I'm working from home, so she FaceTimes me anytime she wants to. So I don't know if your family's like mine, but I'm always available. Now to her, she thinks at least. So continue to social distance. It helps care for your community. To stay up to date on local, state, and national guidelines for testing, quarantine, and general safety, you could visit Whitman-Walker. You can also visit dc.gov for COVID information. Also, wash your hands for 20 seconds at minimum. My advice there, say your ABCs. That is more than enough time, more than enough 20 seconds. So again, stay home if you don't feel well. Also, follow us on Twitter, Facebook, Instagram at Whitman-Walker, and on Instagram, Twitter, Facebook at Real Talk DC _. I'm so happy you all joined me today. Hope you have a joyous holiday season if that's your thing. If not, then just enjoy your alone time and your peace away from work. Whatever it is that suits you during this time, just make sure you do your best to enjoy that. Thank you all for tuning in today. Until next time.